Hello, Hazar, it's Medina again. That video got cut off. There is no enough storage on it. I just have to continue with where I stopped just for the sake of this testing. I'm just gonna continue. So I'm just gonna do another hand hygiene. And I was just doing my last check with the medication, the mini bag, and the vial. So the medication is for Maurice McFerry. Date of birth is August 17, 1944. He has allergies to codeine and Tylenol, and the reaction is nausea and vomiting. My doctor's order is to give 800 milligram, and the first dose has to be right now. So the medication that I draw is 3.2 ml that I'm giving. So I have this here. I'm just gonna take an alcohol swab and clean this. Just going to uncap my syringe and hold this properly and slowly. And make sure it's just going straight, not outside of the tubing. Just try to inject the medication in there. There is resistance. The med is not going straight. I'm just gonna pull it out and give it another. And the size that I'm using is the 22 gauge, which is the 1.5. Going, but it's going very, very slow. So I'm going to take it out again. So I'm just going to remove this. Okay, now it went straight. That's why it's very strange. Okay, I have all my meds inside the bag. Just gonna set the bag under the IV here just to make sure it's sterile. I'm just going to cap my needle that I don't need. And now I have my medication is already in the bag. I'm just gonna give it a shake. I have my label ready, is in the bag of the mini bag. I'll just take this out and put my label properly. So now I have my med ready. I don't need any of these. Now I'm just gonna perform hand hygiene again. I have my fuzzy flush here. If the doctor order is stated it's a normal, it's a saline lock, then I'll just flush it with a 2 to 3 ml. And now I'm just going to start to hang on my medication. So I'm going to take my medication, my secondary line, my meds, and then that bridging doctor's order to the patient's room. So now I'm in the patient's room. Hello, my name is Medina. I'm going to be a student nurse for today. I'm going to provide privacy. I'm going to ask my patient to give me 2 identifiers. So your first and last name, Mr. Morris, and the last name is McFerry. Okay, date of birth is August 17, 1944. Do you have any allergies? Yes, I have allergy to codeine and Tylenol. What's the reaction that you get? I get nausea and vomiting. Okay, so Mr. Morris, I'm just going to give you medication before I start. Do you have any question for me? No? Okay, how is your pain level today? Good. Okay, so do you know why I'm giving you ampicillin? Do you know why you're getting it? No? Okay, so the doctor's order ampicillin, 800 milligram to give it to you just for infection. Okay, it's an antibiotic that you're going to get. If you have any questions, let me know. So I have my medication. I'm just gonna set it here. I have my primary, secondary line. Here, I'm gonna put the tube in there. Taking this out. So I have my medication here. I'll just make sure it's clamped off before I start. And this is the part that is going to my primary line. The primary line is intact and it's up to date, it's good. They just hung it this morning, and it's sodium chloride, 0.9%. So I'm just gonna uncap here. I'm gonna use an alcohol swab. I'm gonna come to the port, and I'm gonna do it closer to the IV side. I'm gonna do this. Okay, so here it's all good. I just want to prime my secondary line before I start giving, before I hang up the medication. And you can see here the chamber is half full. You can see the chamber is half full. I'm just gonna close that. So before I spike my medication, I have the hanger. The medication has to be hanged. It has to be hanged above the primary line, so the secondary line is here. I might just pull my secondary line a little bit down. I'm just gonna pull this out. I'm gonna give this hanging here on my primary line and hang that there. And now I can just this is my medication in the mini bag. I'm just gonna put them up higher in here. It's just for gravity. It's there, so that's my medication hanged. So now before I spike it, I already see that my line is running and everything is patent. I'm just gonna take another alcohol swab. Alcohol swab. I'm just gonna uncap it. Alcohol swab this part right here. Make sure it's still clean, I'm not touching it. And I'm gonna pull this cap out. Okay, just gonna swipe it and it's all good. And now I'm just going to spike it. Twist and push, and it's there. Perfect. So I'm just gonna make sure it's running and dripping. Good. Good. Perfect. So my meds is dripping. I can see it there. So make sure this is just halfway. Just making sure my medication is going to the patient. Perfect. And I can see it running. I'm just making sure here is unclamped. So my meds is coming to my patient. And all my lines is good. Nothing is closed. Perfect. And everything is running. So now that I said everything, I'm just gonna wash my hand again. My medication is already running. How are you? How are you feeling, Mr. Morris? You still feeling good? Okay. So I'm just gonna give you some teaching. If you want to go to the washroom, just ring the bell. Somebody has to come and assist you if you can't, because you have to bring the whole set with you. And also you have to let the nurses know if there is any burning sensation at the side, or if there's any swallowing. So that means your medication is not going inside your vein, it's going interfacial. You have to let us know. And before I go, I have to just make sure that my medication is running at the rate of 100 milliliter per hour. That's my rate. And I'm gonna set my IV pump. So if it needs to be flushed, If there is no doctor's order, it has to be TKVO, which is just 30 ml for 25 minutes. And I'm just gonna set it up at a callback. So when the medication it runs the half an hour, it will beep, then I will just come here and take it out. So if you don't have any questions, I just make sure the bed is at the level, comfort level for the patient, all the breaks applied. I'm just gonna gather my supplies and I will leave. And thank you.